So I had no idea what One Health was until Alex Perlman called me up and said, hey, do you want to do a panel on One Health? I was like, great, what's that? And I pride myself on, being sort of the cartographer for the neobiological revolution. And the idea that this thing was not on my radar was really upsetting to me. And so the fact that we titled this now Building a Global Radar for One Health makes me feel better that this thing was clearly on the radar. But as soon as I heard about the ideas, it just super resonated with me. And so I'm super excited, actually, to have an opportunity to discuss it with two women who think very deeply about this idea. So what we discussed last week is that, we will have some preliminary commentary that will probably take us, I try not to fill the time allotted, because I want to leave some time to have conversation. And I think we're looking for input from you all, and also I think we might be interested in you guys going forth into the community at large and spreading some of these ideas. So this is a multi-way communication platform that we are offering you this afternoon. So my name is Jane Metcalf, and I am the founder of Proto-Life, which is a weekly newsletter about how technology is transforming human biology. And it is the result of my initial work as the founder of Wired magazine, and then time spent in the chocolate industry, and then time spent dealing with medical issues in my family, that I began to piece together this road of digital biology transforming our external structures, like the way we do business and the way we entertain ourselves, the way we design, education, finance, ultimately politics, all of which are like external structures. The next phase of what we used to call the digital revolution is when we turn those skills and tools onto our own biology. And so I call it a neobiological revolution, and I publish stories about this every week. Karen Hogan is the head of lab network partnerships at Concentric by Ginkgo, which is the biosecurity and public health arm of Ginkgo Bioworks. Which I don't know a whole lot about, other than its relationship to COVID. And so I think Karen's been a big part of expanding its mission in a post-COVID, you can't really say post-COVID, we're now living in COVID, but in a post-pandemic environment. She's got a PhD in ecology and evolutionary biology from University of Pennsylvania. Mel Song is a sociocultural anthropologist who studies how One Health is integrated into global health governance tools for systematizing global health security, capabilities and capacities across the Americas. So, for those of you who may not be familiar with what One Health is, I thought we'd turn to our academic who could give us a clue as to what One Health is, and maybe even touch on differences between that, planetary health, and eco-health.
Thank you. Okay, so broadly, One Health is a perspective that recognizes the shared susceptibility of humans, animals, and environments to biological threats. It's an approach to global health research, surveillance, and governance that emphasizes the interconnectedness of human health, animal health, and environmental health. And concomitantly, it calls for multidisciplinary and multisectoral approaches to targeting pathogenic activity at human-animal-environment interfaces, where novel or re-emerging biological threats are presumed to be most likely to emerge. So concrete example of a human-animal environment interface might be when you are, through processes of deforestation or rural development, humans come into contact with rats in novel ways that create different forms of interfaces where viruses can mutate and jump, or increase in exposure, increasing the likelihood of zoonotic spillover. But by foregrounding the interface between humans and animals and environments, One Health kind of reconceptualizes the global biotic world as a complex ecology in which humans, their activities, their bodies, their practices, they indicate just one level of research and intervention within a broader biorisk landscape. So again, like if you're thinking about through a One Health lens, you're understanding the world as a complex ecology. You're applying systems thinking to disease emergence and health. And the humans is just one interface in this complex system. And you can do surveillance on human at the level of the human, you can do surveillance at the level of the animals, you can do surveillance at the level of the environment, you can also design targeted innovations and interventions at different levels as well to increase health and decrease biological risks. I just wanted to, if it's okay, I can go a little longer, that operationalizing One Health is tricky, but it's ongoing. And it's been underway for the last decade or so. Just kind of to provide some historical context, in 2010, the World Health Organization, the World Organization of Animal Health, and the Food and Agricultural Organization signed a tripartite concept note to coordinate global activities by developing like a strategic direction that would link the health and animal and environment sectors to achieve a holistic infectious disease surveillance system. Maybe, and I'm sure Karen can share a little bit more on updates of that, but the point being that One Health as a concept enables sectors to it brings together different activities and different sectors that had previously been separated under this broader umbrella. And in 2014, the Global Health Security Agenda launched to accelerate national compliance with the international health regulations to improve global health security, primarily by linking regional and international surveillance capacities, with an emphasis on identifying gaps between sectors in different countries, and with an aim of developing oversight systems at human, animal, and health interfaces where threats emerge. And I just offer these as two examples of how One Health has been institutionalized in the global health policy space. It's been institutionalized, it's being operationalized, but there's a lot of challenges that remain to actually do this. These are top-down approaches, and there's a lot of bottom-up work that remains to be done.
So we can tease out a lot of these differences as we dive a little bit deeper into the conversation. So let me turn it over to Karen now. And Karen, can you lay the narrative out for us from the COVID pandemic to Concentric?
Yeah, that's great, and really nice to be here with everybody. I'm seeing a lot of faces again, so really good to be in person, actually. Yeah, so Ginkgo has been talking for a while about putting in systems that are, ethically responsible for innovation that they're supporting. So wonderful that we have all of this tremendous biology innovation, but when it moves its way out into the world, what's our responsibility towards maintaining safety, towards maintaining access to innovation, to making sure that wherever innovation is springing from is rewarded, not stolen. And so, yes, which is an interesting point. And so philosophically, have had a lot of time to talk about this. COVID gave the chance to actually put in action what Ginkgo was kind of promoting as part of its value system. So I'm an ecologist, so I just love microbes. I'm really looking forward to like a Pixar movie someday, just around like, the nefarious COVID virus and all of the good microbiome. So I think I've been thinking about complex systems for a long time. But frankly, my kids were sitting on the sideline when COVID hit. They were part of the Philadelphia public school system, and so there wasn't a chance, resources for them to be in person for school. that was the experience of a lot of people who joined Concentric as the organization. Either family members were being impacted by it, they were losing their jobs because of it, they were watching mental health crises in their family as a result. And so recruited a whole bunch of folks to start to try and solve this problem. Like, how are we going to put in infrastructure in response to a pandemic where we can keep schools open, you know, where we can actually start to exist in a world of a pandemic. It's probably like the smartest group of people I worked with, and coming from all kinds of areas. But we're not a COVID testing company. So while we did a lot of K-12, our philosophy for K-12 testing was because this is a community in need. It required innovation because it's expensive to do global biosecurity. It's expensive to run tests across laboratories, right? Like, and schools don't have a lot of money. And the entire economy, unfortunately or fortunately, requires kids to be in community settings so that people can go to work. This is just a reality. We can debate, you know, whether or not we needed to keep people working as much as we required. But we built that system, and then instead of letting it fail, right, instead of letting it just like go back into the closet, we were like, as COVID is circulating, so is Mpox, so is Marburg, so is Ebola, right? Like, this is not a new thing. So how do we take this infrastructure of laboratories, collection partners, data platforms, and start to make them disease agnostic? Okay, this is just like a heartbeat that we should be monitoring in the world at all times. And if you think like a microbe, you're not going to put humans at the center of that. You're going to put One Health at the center of that. And so that's really what we're endeavoring to build, and I hope that we get a chance to dig in on that. I really don't want to just talk. I want to hear the questions and ask the hard questions, so that when we fail, we at least thought about why we're trying to push in this direction, where we're failing, and making sure that failures are just the stepping stone.
Okay, well then hold on to the microphone for now. So let's start by breaking it down. So we've got a sort of theoretical framework to what this is, what we perceive the need to be. So what are the initiatives that Ginkgo can point to? And then Mel will talk about other initiatives that are out there.
So like I said, we started with K-12 testing here in the US, and then we expanded to a traveler-based genomic surveillance system, where we said if you're going to get better at getting signals of diseases, you're going to start doing this in places where diseases have a chance to mix and spread. And so an obvious place is where human beings come together in traveling systems, airports. Okay, and so implemented a voluntary nasal swab collection program. You could come off your plane. Actually, if you're traveling internationally and within the US, you may see our program. It's not diagnostic, it's truly surveillance. So swab your nose, drop it in, answer a few questions, and we'll get the genomic information out.
Is it branded Concentric?
Mm-hmm. It's branded as Concentric. But everybody's tired of getting their nose swabbed. So this is not a great way to do long-term surveillance. And so we started looking at active but indirect ways to do this. And poop is a great way to do that. So you can collect wastewater from municipalities. It's leaving out right now rural communities, so that's something we need to address, because 20% of the world is on, you know, septic, well, 20% of the US is on septic systems. Much of the world is not on municipal wastewater systems, but airplanes have poop too. And so we take poop off of airplanes.
When she said this to me the other day, she said, yeah, we scrape poop off the bottom of airplanes. I was like,
it's a little bit nicer to, yeah. But airplanes are great. They mix everything in the tank as they hit, so you can get representative samples. And if it's right, exactly. And if it's a long haul flight, low pressure helps make sure that people are participating. So yes, we joke about this a lot, but now we're moving beyond the US. So we are expanding our program internationally. We're also looking at how to do this in an equitable way. So a lot of the world does not travel by airplane, so we're going to need to be in other locations for doing that. And it's going to be really resource intensive to maintain this system. So having to think about innovative collection solutions, partnerships, and collaborations in order to keep this, you know, pulse on the heartbeat going.
So a couple of questions for you. So you're focused on transit hubs.
We're focused on transit hubs, yes,
Okay.
at the moment.
Okay. And what about sewage systems? Is that too sedentary to be considered a travel risk?
No, so sewage systems are great. You can actually take septic systems, waste out of septic systems, but so are farm manure pits. So are all kinds of waste streams. You can rinse down the inside of a truck that's carrying chickens across, the road, and you can start to look for high path avian influenza. So this is really a chance to be very creative of thinking like a microbe. Where are these things sitting? Who are their reservoirs? Humans, animals, the environment, and where are they mixing so that disease transmission and spread is happening. And if you can get the genomic data out, the A, T, C's, and G's, you can start to prepare your public health officials to give them an early chance to see if what they're seeing already has medical countermeasure that's efficacious, or do they need to start activating resources, and how soon do they need to do that? How fast is the signal growing over time?
So you mentioned Rwanda. How many other communities is Concentric active in collecting data?
So yes, Rwanda, we're active there. We actually were pulling our first aircraft samples last week and testing them, so this is really cool. We're very excited about it. But we're at 9 total, with more growing, and we endeavored 9 countries, and I think it's, 5 continents now? 4 continents at the moment. Antarctica is going to be a hard one, but we'll get there. Yeah, 7 U.S. airports, yeah.
Great. Okay, thank you. So Mel, I don't know if I prepped you for that question. Can
No,
you speak to it?
Yeah, tangentially, I think what your guys are doing at Concentric is so interesting, and kind of bringing back passive environmental sampling as a legit surveillance technique that we can actually do more things with today than it's kind of quintessentially classical epidemiological form. There's also animal surveillance, and so one of the things that you said, we're looking at basically hot spots for viral traffic. I'm thinking about how since the 90s, Hong Kong, southern China and Hong Kong in particular has been considered a hot spot for influenza outbreaks, and so microbiologists set up research programs there to do animal surveillance in waterfowl, primarily ducks, which is where the flu mutates, and there's a high density proximity of ducks to pigs and humans and birds. So all of these kind of viral mutations and assortments happen in Hong Kong, which is considered a sentinel site or sentinel node. So the sentinel figure, coming from the military, the soldier who whistles at the border to alert his army of a potential threat.
How many sentinel nodes are there in the world or in the country?
I don't know the answer to that question. Do you?
No, I mean, it would be a lot.
No.
Yeah.
But the point, but there's different ways of configuring a sentinel, whether it's a node or a site or a device or an animal. But the point that I wanted to make was that so in Hong Kong, considered as a sentinel site for influenza outbreaks, microbiologists have been doing active animal surveillance in poultry. And then in 2003, when SARS emerged and presented clinically very similar to H5N1, which is what microbiologists were essentially surveilling for, it cost the microbiologists 2 weeks because they weren't testing for SARS, they were testing for H5N1, and they had this whole apparatus established, and they knew where to look, but they didn't know what to look for. And so I think that's an interesting, it's an important part of this is how do we test for multiple potential emerging threats so that we can send out early signals without missing them in advance.
So, okay, great. I want to go back to, yes,
Have you looked at looking for opioids? Because that's something that's really hard to track, and it's even more personally sensitive than some of these diseases. And so much of every hospital says, oh, we've stopped prescribing opioids or something.
right.
They're not aware of what's happening out on the street. You know, we could have caught fentanyl and xylazine or whatever it's called earlier if we were doing that.
So no, we're not. And I think it opens up like a kind of process we have around caring for the programs that we'll participate in. So there would have to be a lot of discussion before we would enable that capacity. Because while it's an important public health information piece, it's a piece of information that can be misused and has been misused. So where public health intervention should happen, policing happens. And so I'm not saying that we would never do opioid tracking. It's just that we have a long vetting around what programs will participate and who will partner with.
But it's very different from interviewing people and knowing who they are versus.
Oh, absolutely. I'm from Philadelphia, so I live in the city that has, you know, the problem. And where it does get back to, I know we'll get to this in a moment, is when we start talking about how you do these systems and actually get buy-in, the communities that have been abused by pharma and abused by people taking their information out of their country and making innovations need to be part of the conversation of who, you know, is going to participate and how they're going to participate. So opioids is controversial. I'd love to keep talking about it.
For sure. Nikki?
I don't know if you're open for questions now or you want to continue.
I'm just losing track of the questions I was going to ask, but I already know what they were, so I'm interested in what you're going to ask.
Well, actually, it was more because what Esther said on the opioids, I just wondered, I really liked this idea of looking at the world, think like a microbe. And I guess I'm curious about how opioids affect microbes. And or the evolution of other kinds of things like farm animals and things like that. I'm just ignoring the other political challenges there. I understand the equity issues, but do we know?
So you're taking me like way back in my career. Yeah, so we actually did some work when I was doing my PhD in stream ecology on pharmaceuticals within water systems, and we were studying specifically fish, which is a common one because it has so many impacts. But yes, there's a whole research center that looks at this, and I'd be happy to point you towards them. The tools for answering those types of questions are emerging, in part because of the people who are here at this conference, because they're pushing genomic and biotechnology solutions further to actually be able to interrogate how a microbe might respond to these chemicals.
Yeah, and it's a really interesting question to your point about the process around caring and that, you know, what you measure becomes something that can be policed. It's like, is it the FDA, you know, or the NIH that's asking the question, or is it the DEA and, you know, some other kind of policing agency? And it gets, you know, to the point of like, who cares? Who's got the budget? Who's going to put the money forward? And that's going to shape the way the program looks.
Well, you can imagine pharmaceuticals thinking I'm not getting a deep enough reach in my market access because I don't see much, you know, opioids showing up in this water.
Right.
I'm not saying that's a good thing. I'm just saying, unfortunately, superhuman intelligences like corporations are not, they don't have the same ethical frameworks.
Right. That's such a terrible thought.
So the social and the cultural stakes for a program like this are so high. So I think the way that we think about it for ourselves and the way that we talk about it to others is going to be so determining of the kinds of outcomes that we get here and the kind of caring that we can bring to a project like this. So I've heard a variety of different sort of metaphors applied to what this activity is. So is it, are you a soldier watching the horizon for threats? Are you a doctor who is caring for a patient? Are you a weather station that is reporting on the trends of the planet to see the weather ahead? And I assume that you think about it in different ways and for different audiences. So I wonder if you could sort of speak to the language that you use for this. How do you see yourselves? How do you communicate the goals of this program to different audiences?
Sure. So I can come at it from more of like a historical perspective. I don't do communication, so for me, it's impossible to understand surveillance. It's impossible to understand surveillance and biosecurity without rooting it in the military. And in the formation of the CDC and the Epidemic Intelligence Services in the history of the United States, which emerged out of like the malaria wartime efforts with the U.S. naval medicine. So a lot of the precepts, the logics, the rationalities, and the techniques that we employ in biosecurity and infectious disease surveillance, you can track, historians and anthropologists can trace directly out of the military based surveillance efforts. That said, you can also do surveillance without it having being securitized, and sometimes I get wary about securitizing surveillance or securitizing viral discovery or pathogen discovery, because when you securitize that, first of all, if you don't securitize that, then you can just be doing microbiology, you can just be doing biology, you can be understanding how the life cycle of pathogens and microorganisms and learning how they work. But when you securitize it, then you can justify new strategies for characterizing the risks of there becoming potential pandemic pathogens. It kind of gets you into gain of function territory, and then introduces a whole new slew of biosecurity risks that are, again, justified under the auspices of securing public health nationally and internationally in the name of security. And then the other, the last thought is, the other concern is a lot of the surveillance we've been talking about here, and maybe Concentric does other forms, but a lot of this surveillance is very pathogen-centric. And so it begs the question of, like, what is the threat? Or who is the threat, or what is the threat? Is the threat the pathogen, or is it the diseases that it can cause? And that's an important conceptual difference with real implications, because when we focus on the pathogen being the threat, we risk undermining needed investments in public health infrastructure and basic public health response capacities, which is not as sexy as capturing and thwarting the potentially dangerous biological threats embodied in the pathogen itself.
Yes.
I'm really interested in the framing of the label One Health, and I, of course, appreciate the genesis, which is the response to transmission of zoonotic diseases. But we're characterizing it really using the frame of the germ theory of disease rather than the alternative end of the spectrum, which is the hygiene hypothesis. I think it's really important for us to figure out where the label One Health is going to evolve to go. Because there are all the functions of our environment. If we're searching sewage networks for, avian flu, for instance, we're also going to be searching for antimicrobial resistant microorganisms. So it's really, I think, particularly in this conference, that we're looking at planetary health, it's important to have that broader frame, perhaps, rather than just the germ theory of disease frame.
Yeah, absolutely, and I think that actually leads into one of the questions that I wanted to ask. So there are different organizations that have taken on this kind of perspective, one being the World Health Organization, one being the Food and Agricultural Organization, and one being the International Organization of Animal Health. And as I was reading over our notes, I was like, well, who represents the microbes? So that's one question, and then the second question would be, what are the obstacles that bringing those organizations together and those mindsets together create? take that on.
Yeah, so I'll represent the microbes. There's a fantastic conference, International Society of Microbial Ecology, which is a great place to see where the microbes are being represented. But I do think that that's actually a very fair point, and definitely like a missing leg right here. So I think very practically, like a lot of what I do every day, in and day out, as my colleagues will tell you, is take what we're all discussing and then just try, and just try. You know, so like, let's go try and set up something and let's figure out where it breaks, and then let's try again. So the biggest, so I'm actually attempting to try to bring together these different groups, and the way I've found it to be effective, and others can offer their perspective, is to not try and solve all of it together, but to start to try to solve some of it in pieces. And so one way we've done this is in the state of Pennsylvania, who's been a fantastic partner to us as we're building out systems. Like tiny little nugget, we got 99% of the county's testing to some extent,
Wow.
which is not easy given the political landscape of that state. So, but one of the things that we're doing there is we're looking at the laboratory infrastructure that was decentralized in that state that we brought together through the Concentric testing program, and saying, okay, how can now we layer in the animal laboratory network that they have, and then their environmental laboratory network that they have that has to run testing for EPA requirements. How can we actually change nothing about what they're doing, but just put them on the same platform? So samples coming in, get registered on the same platform, labs do what they do in their black box. We want them to stay as laboratories. We're not a laboratory. Even though Ginkgo's big, we're not a laboratory. And then how can you report that data out in a de-identified way, because it's surveillance, and have those systems talk to each other? And so we're trying it, in part with deer. So we're actually testing deer for COVID because they've been a major reservoir, and they're a huge part of the hunting economy there, and they don't want viral transfer of COVID to elk, because that's a big one. So we're starting in a state, right, as a pilot, and saying, how do you take these systems and just make them talk to each other? And it's usually some level of data integration to start. I don't know that standards need to be the same across them. I don't even think the priority pathogens need to be the same across them. But we should certainly be looking at like that Swiss cheese layer of, you know, surveilling ducks, you're seeing this. In clinical settings, you're seeing that. In wastewater, you're seeing this.
I wanted to ask you a question directly. So I did my fieldwork in Peru over the course of 2017, 2018, and was involved in the implementation of the joint external evaluation tool with the one which the World Health Organization used as part of the global health security agenda, getting new member states to accelerate their compliance with the IHR. And what I heard a lot there was, as a major challenge, was who is going to finance the integration and interoperability of systems, especially beyond the health sector. And so, and that was at a national, kind of a national context. Like, if you're asking a lower middle income country, like, hey, you got to do 24/7 surveillance in real time, and you've got to integrate the health sector with the tourism sector and the wildlife, this and that, so that your system is not weak. They're like, who's gonna fund this? How do you address or overcome that more at a more local level?
So I'd say one of our biggest advantages at the moment is just the sheer GDP hit that every country took in response to COVID. So if you present this as a wellness movement instead of as punitive insurance, you can directly relate the cost savings with the ROI. That doesn't mean that that's still feasible. And so looking at the World Bank's applications that are coming out for lower income countries, developing solutions that aren't expensive is part of it too. Like pool testing. If you put 20 swabs into a pool and you're only testing that one pool, and if it's positive you're getting a genomic variant out of that one test, you've just reduced the burden tremendously, because you're not taking in PHI, you're not doing individual sampling. So it's that kind of creative mindset of like, let's start the design brief with like limited funds, ease of use, and a system that's really simple to connect. And it's a challenge. I mean, we've broken it probably 10 times, you know, as we've tried to do it. But this is a longer term, this is like the momentum. There has to be some benefit from this data long term for this to be sustainable. So it does have to feed back into the bioeconomy.
So I presume, looking at this from a data standpoint, that the collection of information from all these different species looks very different. It's regulated by different bodies, and the platform, of course, is going to differ as well. So how can the One Health movement change that reality?
These are hard questions.
I'm sorry.
Can we talk in 10 years?
Would you like to take a shot? You can go ahead.
We're standing on the shoulders of giants, so people have been thinking about this for a very long time. So we have, groups like NTI, we have IBIS that's forming, we have groups that WHO, right? This is all they've been thinking about. So I don't want it to seem like we're coming in on the scene and like solving a problem that nobody thought to solve before. It's more just that COVID gave the chance to be innovative, and then as soon as that innovation happened from all of the laboratory heroes who stood up all the laboratory capacity testing, like that innovation was so important. So we're standing at a moment in time where APHI just hit. Everybody was really worried about that for animal health. We have bat surveillance programs that are standing up because they're such a rich source of corona variants. And so I'm kind of watching that system come together. So long as we don't ask for a major infrastructure and regulation change, but instead like backfit the solution into what exists already, which is like frankly stitching things together at this point as like an integrator. That's how we get like the incremental improvements. Say, okay, yeah, we'll try a pilot. Okay, actually that pilot worked. Okay, maybe let's expand this to our state. Maybe let's expand this to our country.
Right. Great answer.
And then, are you having any sustainability challenges? Like these are like you're building this and there's money going into it. So I'm just like the memory of policymakers really short. There's lots of distractions. So I just wonder can you expand on what you're already saying about, how do we make sure this is around in 20, 50 years?
So actually we're experiencing it. So K-12 testing is almost done. I think we have like a couple more weeks left. So the laboratory network that we built out, which at one point was 62 laboratories, some of those laboratories do not exist anymore. They actually shut down. But what we found was, in response to the pandemic, most of these laboratories were doing something else pre-COVID, and then pivoted all of their infrastructure to address COVID, because that's the only thing that was coming through their labs. We took a tiny portion of that to drive down prices to do K-12 testing. Now that we're like coming back to them, we're like, could you do wastewater now too? And it's not the bulk of their business. It's like a low hum in the background, right? And since it's not that expensive, the system contracts. The system totally contracts. But people now have a blueprint for how to expand it again. So that's like kind of keeping that inside. For a lot of these countries, they don't have commercial laboratory infrastructure. They're starting at their national labs, and that's great. And their public health labs.
Yeah, I would say also just at the policy level, there's a lot of work ongoing as well to really sediment this approach. So whether it's, like I said, the Global Health Security Agenda, the Global Health Security Index, the Global Biosecurity Dialogues and the APP3, the action packages that are integrating One Health perspectives and principles into the development of measurable goals, and then the WHO pandemic treaty. So there's a lot of policy work to ensure that a One Health approach to research, surveillance, and governance is being firmed up.
I appreciate your confidence. That makes me feel better.
Yeah, I don't know. Maybe I'm naive.
No, I literally don't know. So
Yeah.
I appreciate you sharing.
It's it is being institutionalized rapidly. How it is implemented, I think that's a different question. The other thing I was just going to say, and this is a softer response, which is that, in synthetic biology, synthetic biology actively reconfigures the relationships between humans and the living world, between anthropos and bios. It's integral to what it is. And a lot of I think there's a One Health ethos in synthetic biology that's just not branded as such, but there is increasingly or always an awareness of the interrelatedness and the reconfiguring relationships between human and non-human worlds. And so there are ways that synthetic biology people or organizations are participating in this active reconceptualization of the human as part of a wider biosocial ecosystem, human health, animal health, environmental health that's interconnected. And so there's practical things that synthetic bio organizations can do, whether that's tech-driven innovations and vaccine development and personalized medicine, or relieving public health authorities of some of the burden of constituting surveillance centers, but also just art and design-driven work to tell stories about the interconnectedness, or citizen science and community engagement, and drawing upon indigenous knowledges. These is more of a softer way, I think, of sedimenting this general One Health ethos of interconnectedness and pushing forward as well.
We have to talk about biostories.
Sure. Okay, so what I'm just saying, this comes from some of the work that I had the pleasure and privilege of doing with the World Economic Forum's Global Synthetic Biology, Global Future Synthetic Biology Council.
Close enough.
Yeah. And Favor Futures, a design firm based out of London, and with Megan Palmer, as well as the executive director of the the Biopolicy Leadership in Society initiative at Stanford. We wanted to tell compelling stories about we wanted to give opportunity for synthetic biologists from all different places in the world and coming at the work SynBio from different angles to tell stories about their preferred futures and how their practices in synthetic biology may get us there, and what are some of the core values driving us towards preferred synthetic biology futures. And everything that I just said is grounded in my own rigorously empirical analysis of conversations between diverse stakeholders in this area, who largely talked in this way, ecological understandings of the relationships between the humans and the non-humans, so including animals, but then also the environment, whether that's living or not living. So I see, by the way, it's called Biostories, and you can Google and download the report. It's absolutely beautiful. There's a speculative fiction component to it. There's beautiful photography. There's an art installation at this year's Venice Biennale. It's an incredible project. But anyway, it was based on these stories that really, brings to life a One Health view, if we define the One Health view just as a holistic understanding of the biotic world in which health and disease transpire.
Okay, so now I have to say something, because the interesting thing to me is the extent to which technology has exposed for me truisms. The emergence of artificial life experiments back in the 50s, where computer coders would actually create digital systems with digital life forms that were given a very like the minimum operating system required to be a life form. They were given like 2 or 3 rules, like you have to get energy and you have to reproduce, or maybe that's it, maybe those are the only 2 rules. Ray, Thomas Ray, I don't know if you're familiar with his work in Costa Rica, he was an evolutionary biologist, but also Boyd's. So I don't know if you know about this, but anyway, the old timers in the room, the OG people are going, the rest of you are clueless.
John
but-
Conway, Game of Life, John Conway.
Yes, very good. But so these digital simulations showed us some truisms, and so with the example of Boyd's, these bird-like digital creatures began flocking behaviors which had never been coded into the creatures. There were no rules that would have predicted that flocking behaviors would emerge. And so I'm constantly, I just had this amazing conversation with Roger Peterson, a stem cell biologist who was the inspiration for Mark Cotter and the founding of BitBio, and talking about what we've learned from emerging life and stem cell reprogramming, and it's interesting that the further we push with our machine learning and artificial intelligence and our digital tools and discovery, interestingly, I feel like it brings us full circle, and it brings us back to what ancient cultures knew so well, and that our medicalized medical industrial complex has distanced us from. And so at the expense of, turning into a hippie here in the last few minutes, I can't but help think that, this is a very holistic place to be arriving. And if this really is the century of biology, then we need to take the human out of the center of the equation. And, Mel, I'm going to steal your point because I'm afraid we are 5 minutes over. But she wrote this fabulous paper in which she said, humans consider themselves the source of all things, good and bad that happen on this planet. Like it's our encroaching into the wildlands, which is, provoking these pandemics and zoonotic diseases and so forth. But the bacteria are evolving, the pathogens are evolving, the animals are evolving, the ecosystems in which all of these things exist are evolving. And so this whole kind of Anthropocene, where the human is at the center, is not only perhaps giving way to what did you call it?
I think I called I said the Anthropocene it's narcissistic. It's narcissistic, and that there are ways to be to think about anthropogenesis as yes, we change the world, but the world also changes us, and you can think about anthropogenesis in a way that is anthropocentric without being anthropocenic.
Oh. Nobody's come in here to interrupt us, but our time is out. Does anybody have any other questions?
I did, it's so amazing wandering the halls here and talking to people and seeing presentations and visiting the thing, and I'm just kind of curious, what have you seen that gives you hope or inspires you or was a surprise this year that you didn't see last year or a few years ago?
So we have to use like the existing financial systems and capitalistic values to actually like pull this forward because we need money to do it. But I really love seeing younger people because we don't have to design systems and the same constraints for the next generation. So I'll take advantage of what's here to push it forward, but seeing the innovation and seeing where their drive is really speaks to like a fundamentally different value system that makes me really hopeful.
So I wanted to give Mel that mic drop because it was just so good. But there was one other thing that we were going to do, which is I've gotten all wondering what you can do to forward this perspective. And so I asked these women to think about that. And I don't know if you have any thoughts.
Can't hear
You
you.
can't rely on Jake's
I was just saying,
Twitter feed.
I think I'd like to end on the high note.
Yeah, so I love nature. That's why I did my PhD in it. And I think just encouraging and making spaces and chances for people to interact with nature more, paying attention to communities that don't get that access or are blocked from it, and making sure that resources go there is the thing. And just like literally getting out there, just experiencing it and being part of it. Like, that's an action everybody can take every day.
Just really quickly, just add that this is my first time at SynBioBeta, so I can't, I have nothing to compare it against. But there's really interesting work being done in personalized medicine and drug development, and really interesting, important, cool work. And I'm also really interested in potential public health interventions and diagnostics that are not, again, not only leveled at the human. So like genome editing, I think of Kevin Esfeld's Mice Against Ticks project in Nantucket, like genome editing white-footed mice to intervene into the increasing number of infected ticks. That's not branded as like a One Health intervention, but it feels kind of aligned. Like it's a way to leverage, the more than human to solve multi-species health problems. I think what you guys are doing with the environmental waste surveillance is another example of leveraging activities at the non-human level. And so, I think that I'm really interested in any of this in bio-innovation that targets the human, the non-human, the animal, and the environment as ways to drive innovation that could be useful for public health.
Okay. I'm on editorial deadline, so I'm gonna end the panel now. You guys can keep talking, I'm just gonna go. But thank you so much for coming. Thanks for your contributions.